And we have a closer look at a new report on caregivers. There are more than 60 million adults in the country providing that care for other adults or kids with medical needs. That's 1 in every 4 adults in America acting as a caregiver. Iowa's News Now reporter Faven Zodu is live in studio with a local look at the report.
Nicole, caregivers in Iowa tell me it's a responsibility that requires juggling a lot of different things, and there are more than 500,000 Iowans trying to do that for their loved ones every day.
Primary caregiver for my mom and for my parents, both that suffered or lived with Alzheimer's for many years now.
Michael Wagler isn't just the AARP director of Iowa. He's one of the 63 million Americans who are caregivers of some kind, and one of the 59 million providing care for adults with complex medical needs.
They take on everything from grocery shopping to driving their loved ones to doctors appointments to meal prep and managing medications. But the reality is some of them also handle more intense responsibilities like bathing, dressing, and handling medical tasks, oftentimes with very little to no training.
More than a quarter of Iowa's adult population are handling all of that, and Wagler says there are countless situations where care is needed.
A family caregiver is something that changes and evolves over the course of time. So that could be someone who's caring for their spouse. It could be someone like myself that is caring for aging parents and kind of sandwiched in the middle with also caregiving for kids as well. Or it could be providing care for a younger person with a mental challenge or a disability.
The biggest issues are usually the costs of time and money. About 1 in 7 family caregivers in Iowa are working at least 40 hours a week on care, on top of their regular full-time jobs.
It may be the accessibility or even the attainability of being able to pay someone to come into your home or to pay to live in an institutional living situation where you're having that full-time care. Many times family caregivers, that the situation comes out because of a financial reality of how to save money or how to get a service that may not be attainable or accessible from your financial situation.
That's why Wagler says it's so important to give caregivers the resources they need.
The reality is that there is a higher prevalence of chronic diseases that are creating greater challenges for all of us as we age. And so that demand for care is only going to grow in our state and across the country. And if you're not a caregiver now, you will likely be one in the future or need help yourself.
AARP does have resources for people trying to navigate life as a caregiver. Here at iowasnewsnow.com, you can go to iowasnewsnow.com for a link to those. Live in studio, Faven Zodu, Iowa's News Now.